Hello, class. My teaching topic is safe sleep, sudden infant death syndrome, also known as SIDS. So, what is SIDS? SIDS is the sudden death of a baby younger than 1 year of age. There's no known cause, and it's the leading cause of death between 1 month and 1 year old infants. Well, what are the potential causes? It's usually accidental, and it's due to suffocation because objects like pillows, stuffed animals, or blankets accidentally cover the baby's face somehow. Or it's by strangulation by loose cords that are strewn about a crib, or it could be by entrapment. It's hard to describe entrapment, so I'll just show you what it looks like on this picture. This is entrapment. So what are the maternal implications? Mothers are going to want to get regular prenatal checks because this might help prevent a baby from developing any abnormalities that could put him or her at risk for sudden death. And the mother's going to want to avoid smoking, drinking alcohol, marijuana, and other illicit drugs. Because as we've been taught in nursing school, these are teratogens for the baby, or the fetus, rather. And we do not want to allow smoking around or near the baby or its sleep environment. Because according to the CDC, chemicals in secondhand smoke affect the infant's brain in ways that interfere with its regulation of the baby's breathing. Here's one more maternal implication to consider. According to Lullaby Trust, breastfeeding for at least 2 months halves the risk of SIDS. This is because breastfeeding improves the baby's immune system development, promotes its brain growth, and reduces reflux. So how can we avoid SIDS? First, sharing a room is okay, sharing a bed is not okay. This is because the parent is prone to pushing the baby off the bed, or they might fall on the baby when they roll over and suffocating the baby that way. This picture here is the ideal situation in terms of sleeping arrangement between parent and their newborn. You want the baby in their own crib, and you want to have the parent sleeping in their own bed. And you want to lay babies on their backs on a firm mattress. The reason I say firm surface or firm mattress is because soft surface mattresses, they can cause uneven bed surfacing between the baby's body and the baby's head, and sometimes it can cause the baby's head to slump forward and cut off the airway to the baby. No pillows, no blankets, stuffed animals, toys, sleep wedges, or cords near the crib. It's because all these objects are suffocation hazards in case they cover the baby's face. And the cord is a strangulation hazard because it might get wrapped around the baby's neck. And lastly, you want to keep babies' heads uncovered during sleep because sometimes head covers come off the baby's head while they're turning, and this could pose as a suffocation hazard as well. So how else can we avoid SIDS? We want to utilize a pacifier, and for various reasons. It keeps the tongue forward, it increases upper airway tone, it may keep your baby's nose off the bed if the infant turns prone, and sometimes losing the pacifier might wake the baby up, and this could alarm the parent to attend to their baby quickly when that happens. So how can we regulate your baby's temperature to avoid SIDS? First, you have to monitor your baby's temperature, and one way to do this is you take the back of your hand and you touch the baby's chest to determine if it feels hot or not. And if it feels hot, this might be a sign of overheating. So to avoid that, you want to avoid swaddling your baby too warmly. A way to do this is maybe consider investing in a wearable baby blanket. If you don't know what that is, it's in this picture right here. So if SIDS does occur, as a nurse, you want to refer your patient to a support group, and you want to rule out abuse, and you want to encourage your patient to express their goodbye. However, if you're the patient who is experiencing SIDS, yeah, the reason you might want to consider going to a support group is because your family and friends might not know exactly they might not be able to relate to what you're going through. You might want to hear from other moms or dads who have experienced SIDS, and you want to find out what they're doing to get through the tragedy. And you might want to share your point of view about SIDS to them because they'll understand. And the reason as a patient you want to express your goodbye is because uh, although this is an extremely painful, tragic situation, you don't want to block it. You don't want to repress this moment in your life. You want to try to live through it the best you can, and that's how you'll be able to move on from this. So I want you to take a moment and pause the video and look at everything you think is wrong with this picture right here. Try to think of 5 things wrong with it. There's 8 things wrong, but I want you to find at least 5. So here are everything that was wrong with that picture. Sorry about the audio quality, it's not the best. Anyways, here it is.
Oh my god, my baby. What's this knife doing here? This shouldn't be here. I was told there's not supposed to be any stuffed animals here either. Sorry, Wally. No toys. I'm not allowed to have toys where the baby is. Oh my god, this cord. This cord's strangling my baby. Babies aren't supposed to be sleeping with blankets on. Why is he on his face? He's supposed to be right side up like this. And no pillows either. Oh my god, I'm not supposed to be in the same bed as my baby. He should have his own crib. Oh my god, now he's dead. I have to perform CPR.
Alright, let's do a video recap. In case you couldn't hear the audio, let's just go over everything that was wrong with that picture. First off, no random kitchen knives. No stuffed animals, no toys, no cords, no blankets. Baby should be positioned supine instead of prone like the baby was in that video, and no pillows or sleep positioning wedges. All these inanimate objects, not including the cord, are suffocation hazards. And the red cord you saw, was a strangulation hazard. So don't charge your phone anywhere near your baby's crib. And no bed sharing. That parent in that video should not have been in the same bed as the baby. The baby should have been on the crib of their own. Here are my references. That concludes my presentation on SIDS. I hope you learned something about SIDS. Thank you very much for listening. You guys have a good day.